Hello, everybody. My name is Bala Lodhia. I am from Toronto, Canada. I'm going to show you working mostly with the auto-meridian screen, how you can use it very effectively by using piggyback therapies. You can use the auto-meridian for doing single points. You can use it multiple points for emotional, physical, all kinds of problems. So I'm going to give you a preview of what can be done with the auto-meridian screen. Mostly acupuncture is done by a licensed practitioner, but as a biofeedback therapist, one can relieve stress by using the auto-meridian screen and using matrix items as piggyback therapies. In acupuncture, there are 12 meridians, 6 yin meridians and 6 yang meridians. Now, in the main 12 meridians, these are points which some tonify, some disperse, the source points, the front move points, and the back shoe points. Right now, it may not make sense to you, but as we go along, you will get to understand more of it. The lung meridian. The time at which the lung meridian is most effective is 3 a.m. to 5 a.m. So it gives you an indication that if someone comes to you and say they get up at 4 o'clock every morning and they have some symptoms, then you know that the lung meridian is affected at that point. It governs qi and respiration. Lungs rule the surface, the skin surface, and governs wei qi. Regulates water passages through the body, controls perspiration, and the lung disperses and descends qi. It opens to the nose, manifests in the skin and the hair, and also governs the voice. In a situation where the lung is in excess yang, you get pain in upper back, shoulder, chest colds, stuffed nose, hoarseness of voice, wheezing, frequent urination, heavy chest, and nasal discharge. In a deficiency situation, pain and coldness in the upper back and shoulder, shortness of breath, change in urine color, rumbling in the bowels, loose bowels, light cough, sensitive to cold. Now, I'm showing you also some points that can be used to treat different areas of the body. And these points can be typed onto the auto-meridian screen, which I will come to and I'll show you the methodology I use. Common cold, acute and chronic bronchitis and bronchial asthma. These are the points that are most effective. I mean, there's many points. People who study TCM for many years have a methodology where they work on different meridians and they work on single points as well. But here what we're doing is, using the SCIO, we can do combination points and get almost as good results. Now the spleen meridian, it's most active 9 a.m. to 11 a.m. The spleen is like your transportation mode for transporting food and nutrition to the blood. Keeps the blood in the vessels, governs muscles, limbs, and flesh. Controls taste, distributes each flavor to proper organ. Keeps the organs in place. So in cases of prolapsed organs like prolapsed uterus, prolapsed bowel, the spleen meridian is effective. So that's where you work on, is the spleen meridian. Opens to the mouth, manifests in the lips, and the spleen qi ascends. In a situation of excess, there's abdominal pain, irregular pulse, stickiness in the mouth and lips, chest congestion, fatigue, and constipation. In a deficiency situation, abdomen is tight, distended like a drum, craving for sweets, flatulence, nausea, mild edema, memory failure, heavy feeling in the legs, pale lips, and chronic diarrhea. And here's some points. Actually, this presentation will be given to the QX Subspace website, so you will be able to download it. If you don't, let me know and I can send you the presentation. In case of duodenal ulcers, nervousness, dyspepsia, hepatitis, anemia, and chronic dysentery, Moxa can be used on all these points as well. So through this method, what you can also almost teach yourself, because when you go to the automeridian screen, you can actually go to any of these points. And there's little hints that are given to you here as well. So this way you get to learn. It's almost like a self-teaching process where you learn the points and then you know where they are on the body. So these are the points: spleen 2, spleen 3, bladder 20, stomach 36, liver 13 and liver 12 are all work around the spleen, treating the spleen. Now there's to boost the spleen for immune, when there's an outbreak of some kind of influenza, things like that, you know people are prone to catching sick. This is what you use to stimulate the immune system. So you can, if a client comes in, you can just do a quick session with these 1, 2, 3, 4, 5, 6 points, and just give them a little treat so you get a correction, and then you know that the immune system is just reminded not to go into a total alarm phase when they do get affected by viruses and bacteria. The heart meridian, 11 a.m. to 1 p.m. And statistics have shown that most heart attacks occur around this time. And in a lot of these countries, the hot countries, where they take a siesta after lunch. Now the Heart Association has now almost recommending that people that have had bypass surgery and have had any kind of heart issue after lunch, they should be resting. So heart governs the blood vessels and the pulse, stores Shen spirit and mind, governs the speech, governs all yin and yang organs, and opens through the tongue and manifests in the face. In a situation of excess, anxiety, frightful dreams, nervousness, heavy chest, hot sweat, tongue feels numb, dark colored urine. So these little symptoms are little clues that once you remember and the client tells you, all of a sudden the urine is showing a different color, then right away you can think, okay, let's check the heart meridian, and you can do a test to see at what level the heart meridian is. In a deficiency, there's inability to speak, cold feeling in the chest, limbs, palpitations, impaired memory, restless sleep, and nocturnal emission. So here we can treat, I've used these for tachycardia, arrhythmia, anemia, hypertension, hyperthyroidism, depressive neurosis, extreme malnutrition, insomnia, and these points are very good to use. The kidney meridian is between 7 p.m. and 5 p.m. and 7 p.m. It's responsible for reproduction, growth, development, rules bone and marrow, governs water metabolism, receives qi from the lungs, activates the spleen and lungs, responsible for heart balance, base of all yin and yang organs as well, gateway to the stomach, opens to the ears, manifests in the head hair, responsible for hearing. In situations of excess, kidney patterns are much more deficiency than excess. In case of deficiency, it's lumbago, sciatica, various false heat conditions, lack of will, low sex drive, negativity, impatience, timidity, coldness in lower limbs, premature, senility, poor memory, and dullness. And here's some points I've set up here for impotence, frigidity, prostate problems, asthma, lower back problems, knee pains, tinnitus. The pericardium meridian, 7 p.m. to 9 p.m., surrounds and from the heart, protects heart from exogenous factors, draws any excess away from the heart, circulates kidney yang, qi, and activates all yang, yin organs. In excess is cardiac pain, light sleep with too many dreams, heavy head, headache, stomach pain, impacted feces, head and neck stiffness, palpitations, fear of heights, and indigestion. In a deficiency situation, stiff neck and head. And here's some points that are for coma, nervous disorders, and mental disorders using the pericardium meridian. The liver, 1 a.m. to 3 a.m., stores the blood, maintains free flow of qi, governs muscles, tendons, and ligaments. So in cases of all kinds of athletic injuries, excessive strain to muscles and ligaments, if people are in good shape, and if their liver is in good shape, they can work to an excess, but they won't strain the muscles and ligaments. No sooner they end up straining the ligaments and muscles, you know that their liver does not have a good flow of qi. So that's the first place you have to work on. It's responsible for bile secretion, promotes function of all organs, primarily stomach and spleen, influences emotional balance, controls mental functions of planning. Liver opens to the eyes and manifests in the finger and toenails. And as we know, the liver is also the organ that's most affected with anger. Anger affects the liver, and when your liver is affected, it makes you more angry. So it's a compounding problem. And the old Chinese terminology that the door to the liver is through the eyes. So if people are having chronic eye problems, then you know the liver is definitely has a problem. And here's some points for hypertension, migraine, conjunctivitis, otitis, eye issues, anger issues. And these are the points that are used quite frequently and quite effectively. Now the method I use is, this is just, I'm giving you an outline of what you can use, but my methodology that I use on my patients is, I always see what the patient has come in with, because no two patients are alike. You have to see what the SCIO is giving us information to that client, and then you can apply some of these protocols. But you have to tailor your treatment to the client. Every patient that you see is a new teacher for you, because no two patients are the same. Large intestine meridian from 5 a.m. to 7 a.m. governs transportation and conveyance of turbid waste, absorbs fluids, important for Wei Qi problems, facial and sinus problems. Large intestine, Qi descends. And warm, in excess, it's warm and swelling along the course of the meridian, distended abdomen, dizziness, constipation, yellowish orange urine. In the deficiency, cold, shivering, difficult getting warm, rumbling in the bowels, and diarrhea. I've found some points over using, there's many different acupuncture charts and points and recipes that, for lack of a better words, that you can find. And I found these are most common denominator in most of them: acute dysentery, acute colitis, intestinal abscess, constipation, parasitic invasion, and like pericardium 6 is also good for appendicitis, gallbladder, the governing vessel 14 for appendicitis, bladder 25 for parasites, spleen 6 for constipation, and the CV meridian or the Ren meridian for parasites. The stomach meridian, 7 a.m. to 9 a.m. SCIO of nourishment, governs decomposition of food. Stomach and spleen are the root of postnatal qi, I beg your pardon. and the stomach chi descends. In excess, hot abdominal area, overactive digestive system causing hunger and thirst, dark yellow urine, gluttony, halitosis, swollen gums, red dry lips, and cramps in legs. So these are all little clues that you look for as you work with the client, and then you can keep that as one extra protocol that you can pull towards working with your client. I've put here gallstones, anorexia, gastric ulcer, gastritis, and diabetes. Gastric ulcer I've done in red, which is specific with stomach 36, CV12, bladder 21, CV6, and liver 13. The small intestine meridian separates clear and turbid fluids. Clear fluids become bodily fluids, turbid waste become waste. Responsibility for the quality of the blood, responsible digestion and absorption. Small intestine diseases are related to stool and urinary disturbances. One of the things I have found also that people are in a habit of taking antacids because they have chronic heartburn, indigestion. What happens is the antacid or drugs like acid-cutting drugs that the doctors prescribe, it cuts out the acid production in your stomach, which is the wrong thing, because the stomach needs acid to break down the food. What happens is when you take alkaline acid-cutting drugs, the stomach walls do not secrete any hydrochloric acid. So undigested fats and proteins are led into the small intestine, because when the pH is alkaline, that's when the food goes into the small intestine and not being broken down. So as a result, you end up with undigested fats in your small intestine, which end up in your heart. And fats end up around the mid area of the body. So people, they think they have indigestion, heartburn, take a Tums, take an antacid. It's the wrong thing. They need to balance. First of all, find the cause of the heartburn. In most cases, 6 out of 10 cases, it's H. pylori bacteria, which can be easily resolved with Manuka honey from New Zealand. Very simply. Absolutely. Just a teaspoon of Manuka honey get the one from New Zealand, and you take it at night or in the morning for 15 days, and it takes care of H. pylori. I think 25 plus is fine, yeah. One teaspoon a day, yeah. After 15 days, and what I found that there's other parasites that infest our gut and things like that. So what I found is that any kind of parasite remedy that you use, I get the best results when they're taken the day before the full moon. Like people who have a lot of parasite infestation, I use wormwood, I use tincture of black walnut, I use simaruba bark tincture. So I give them a low dose on a daily basis, like 5 drops a day. And just for the 7 days prior to the full moon, I up it to 15 drops. So this way, we want to get the cycle broken, because parasites die off and the new eggs hatch in the full moon cycle. So food poisoning, bowel obstruction, nervous dyspepsia, chronic dysentery, hernia. The bladder meridian receives, stores, and transforms fluids prior to excretion. Bladder chi descends. Headache, olfactory problems, pain along the spine or the waist, congestion in the abdomen, insufficient urine, or cloudy urine. In a case of deficiency, there's nosebleed, frequent urine, excessive urine, back pain, and nocturnal enuresis, which means going to the bathroom at night a lot. Here's some more points that I've added here that you could use for any kind of a bladder issue. The triple warmer. It's the upper warmer, dry respiratory function, absorbs air, forms and circulates qi, primary organs, lungs and heart. The middle burner, dampness, digestion, function, and the primary organs of the stomach and the spleen. And the lower burner, energetic elimination function, primary organs are liver and kidney. Deficiency of yang in the upper burner results in phlegm. Deficiency of yang in the middle burner results in stagnation and belching. And deficiency of yang in the lower burner results in edema and urinary problems. So here what I've done, I've tried to make it as simple as possible. There are points for upper burner, the transitional burner, middle burner, and the transitional from the middle to the lower burner is CV10, and the lower burner points as well. And triple warmer 5 works with all burners. The gallbladder meridian stores and secretes bile. Gallbladder qi descends, responsible for mental functions and decision making, closely related to the liver. And gallbladder, I find also, is a very, parasites love being around the gallbladder. That's why Hulda Clark always recommended doing a gallbladder flush. All of you know how a gallbladder flush is done, right? If you just Google Dr. Hulda Clark, gallbladder flush, and she has a very nice protocol. It can be done in 2 days by using olive oil and lemon juice. One of the things with gallbladder that stands out is if somebody who is very nervous and they startle very easily, like if they are busy talking to somebody and somebody creeps up to them and they jump, it shows that they have a deficiency in gallbladder. And children do that to their mothers, try to scare them all the time. It's also not good to do because you affect the gallbladder. Now here's the automeridian screen, which I'm going to now go to the actual screen itself to show you the methodology that I use. So first of all, I do a start and then do the retest. Any questions so far? I use the automeridian screen after I do the test, the retest, and then there's a screen where you go to the AccuDiagnosis and it opens up another panel, and where I'd like always to do a repair also. Basically, I balance the meridians totally and then do any testing. If I want to test any remedies, or if I want to test if you have a product you want to put on the test plate, you can test it by doing that. But I like to balance the meridians first and then do any testing. And also, this way you can, any product that you're going to use, you can see which meridians it's going to help. For example, if your client has an issue with the liver and you're giving him a product, the product may resonate well in all the other meridians but really won't do anything for the liver. So you may want to have to change the dosage of it or try another product. They don't have the resolution of the projector doesn't show a lot of the buttons, so we'll have to kind of fiddle with it. Okay, we do the retest. Okay, when that opens up, there's a repair all button here. This one. I click on that to try and get the points balanced, and then we can start working on the screen itself. Now this does, sometimes you may have to go twice, 3 times to get this screen balanced. Okay, so that's balanced. Now, if it doesn't balance, then the numbers will still show up there. Then what you have to do is you close this, you open this screen, close it again, and then go to acupuncture diagnosis again, and that repair button will show up again. So now, at this point, this screen here that shows the consciousness form test, 11 is the default, basically. 11 is a default with nothing in there, so there's no meridians typed in there. I've used, like, you can do one, because the consciousness has picked these points right now. But just for demonstrating what I'm going to show you is on the automeridian screens. Here's an example for tinnitus. I wonder if I can get it bigger. So what I do is, using these points, I put these points on that consciousness form test, and we would add those points in there, and here we type in psychological disorder with stress, and the physical disorder is tinnitus. And you can hit start, and you should look for a rectification of at least 80. Now there is a point in here where at the bottom of the screen, which we cannot see because of the screen resolution. Below here, it says, there's a box in which it says points. I'll show it to you on the presentation. Oh, there's a little box. It doesn't show on the screen because there's a little box here where it says type in concerns or whatever you're looking for, but I clear that screen, make it blank, and I type in the piggyback remedies. You can pull them from the matrix. You can put matrix numbers, or you can put the actual remedy the way it's written in the matrix. And when you piggyback them, the remedy is piggybacked to this treatment plan. Are you with me? Okay, good. See here again, the screen is... What I've done is I've made a screen, different acupuncture points on conditions, points that you can use very effectively on the matrix, like anal retentive, extra B09, Narayani special 5. That's a piggyback remedy which you can use. So you could actually just go into there, clear all of these, or to go straight to the point. For example, you can go to XB09, XB09, there you go. And at the bottom here, you can type in the piggyback remedy, and then when you treat, you get a rectification score up there. And when it's balanced, the point is balanced, this panel, you'll get a green panel showing at the bottom, which is this panel here. This red panel, it'll turn green. When it turns yellow, that means it's still not corrected, so it's at 63%, so we do it again. Now there is a very good it's on the matrix, unconscious resistance to change. And many a times you get a client that just, you can tell that there is an unconscious resistance for them to change their lifestyle, to make any improvements. So I pull that into the treatment, and the points that I have used very effectively is this point here. And in the box, in the piggyback, I type in unconscious resistance to change and treat this point, because see, for low back concerns, addictions, fear, and feeling stuck. So go through these points in here. They're very, very informative, just from the little bit of information that's on there. And you'll get a lot of benefit just reading the points. There's people who take all kinds of enzymes in their diet, extra added enzymes. They can take all they want, but if they're not balanced, it's not going to do any good. So you go to this point like this, and you can actually balance the acupuncture point and then test the enzyme to see if the enzyme is going to do any good for them. It's all there. It's no mystery. There's one here for vitamin C. People take all thousands of milligrams of vitamin C, and they're still not well. So they're not absorbing the vitamin C that they're taking. Possibly it could be not the good quality vitamin C, or the body just doesn't recognize it. So you have to, so through this screen, it's a self-learning thing you can go through, because all the little points and things are there. So here I've got anger and loss of self-control. There's a point I've given you there, and Narayani liver. It's a very good mixture for all liver conditions. Anger and loss of self-control, same thing. Argue about everything and sees only the negative. We use this one, and again, the Narayani remedy, bad temper mix. There's a points here for diabetes as well. Now, when there's that many points, that's when you go to the consciousness form test, and you add the numbers in there. So sometimes I leave the numbers what the unconscious has chosen, and in the wherever there's 11s, those are blank, so you can add your numbers in there. So you just go delete it, type in your number, GB 13, whatever points you want to type in. And quite often, by the time you've done your calibration and initial test of the matrix, you can kind of figure out where the client is at emotionally and mentally. So you can kind of figure out that either they're very negative, or they have a lot of grief, or they have any kind of emotional issue, you can type it right in there. And the physical disorder, what they describe, you can type in there. And in the piggyback box, which is the white box at the bottom, you type in any remedy you want. You may have some of your own remedies that you want to use. Place it on the test plate, and then you give them a treatment. There's some good ones. Your inappropriate thoughts of dying, anacardium or a metallicum. It's a specific homeopathic for that. Inflexible mind and body, Natrum self, Narayani meditation. There's a point in here that's actually I find very useful with most clients, is to bring all the chakras into balance. This one, yeah, these 4 points. It really, really works excellent with kids. Like when kids are, when you got them in there and they just not cooperative in any way, and they just impatient. So I quickly go to the screen and get this thing done, and I treat this point here, these 4 points. In fact, we have done that. Those who have done acupuncture will tell you that kids that are really badly behaved, in those 4 points, we put very thin needles obliquely that way, this way, down that way, and that way. And it calms them right down. This is an excellent protocol that was taught by Dr. Mendez from South America. And he was working, I met him and I worked with him at a conference in Milan, Italy. And the company that makes these remedies is called Guna. They have an excellent plant in Madrid. I beg your pardon, not Madrid. Is it Madrid? Guna is in in Spain. Guna is in, no, beg your pardon, Italy, Milan, Italy, I beg your pardon. Milan, Italy, and Dr. Pera, who did all the testing of the homeopathic remedies that Guna made, when he presented it to the Italian government for registration as a homeopathic, they took the application and they threw it in the garbage. So he said, I have to give them something that they understand. So he sent it to them again, low dose remedies, 10 to the minus 18 dilution. So when he gave them a mathematical dilution, they understood that. And the Guna remedies were accepted. And I got Dr. Nelson to put all the Guna remedies on the matrix. They absolutely work amazing. Now, there's Omeo formulas. You'll see Omeo Formula 1, Omeo Formula 2. I've given you the name and the matrix number. So it makes it a lot easier for you to use. Now, those of you who are allowed to do acupuncture and do injections, what I've done is you take the actual formula from Guna, it comes in ampules. We use a 30 gauge needle, very, very thin. And at these points, we inject it just below the skin. You create like a little bubble at the points where we put them in. But since most of us are not allowed to do that, I figured a way that we can pull those remedies from the matrix, put these points on the screen, on this one here. You could pull those remedies and put those points in here. And at the bottom here where the piggyback remedies, you can pull the matrix numbers of the remedies you want to use. And it's basically the acupuncture points for the chakra points. The pineal gland is due 20, which is right in the middle of the head. extra 0.1, thyroid is REN 22, thymus is REN 17, solar plexus is REN 12, adrenals REN 5, and the gonads is REN 2. So at these, if you add these points on the consciousness form test, piggyback these remedies and give them a treatment, it basically, I found it very, very helpful in the case of menopausal women, when you need to bring the metabolic balance back to order, people with thyroid problems, any kind of an endocrine disorder.
So would you put them in the little boxes down the left?
The green box. Yes. Yeah. Yeah, exactly. Here's a good protocol I've had good success with using for tinnitus, these points. And the piggyback remedies I used was a classical homeopathic is gin and self. Arnica is another classical, and the liver gallbladder, because liver gallbladder is one of the key disturbed meridians when there's tinnitus. Is everybody with me so far? Any questions, don't hesitate to ask. And here's a little thing I took from Dr. Ego. Sometimes you have, once you balance the meridians, you got that. And if you've got a condition that a client has, like, give me an example of anything that somebody always complains about, or fatigue. So you type in fatigue there. And you're testing it with the meridians. Now, as we know, the white and the fuchsia is good. It's helping those meridians. But now, in this case, when we type in a condition, we're looking at what shows up in greens and yellows. Green is here, yellow is here. So and the allergy meridian. So it's another clue that you can pick up, that if you type in, say, osteoarthritis or fibromyalgia, which is the most popular thing that everybody comes in with, and you'd see which ones show green and yellow. And that's thanks to ego. Certainly, please do. Yeah. What he said, in this line, you can type in the unconscious resistance to change. Any kind of verbal thing that you want to put in for that client. What you've picked up, as you're talking to the client, you kind of interact with the client and you pick up things what the client is. So you type, put a little verbal thing in here and double space between each phrase. And then do a test. And it's amazing what shows up in yellow and greens. He said you type in spiritual oppression. Yeah. And then you test again and see where the yellow and the greens are. And then keep working it till it clears up. Pardon? I guess you can put it in your language because it's interacting with your consciousness. And I just was told that, I think last week we were discussing it, that when you're running a test on a client, it's best to be, because we are connected to the higher consciousness. Your client is connected to the higher consciousness. So it's a three-way loop. So if somebody else is in the room, you should ask them to leave until you do the calibration and the testing. After the calibration testing is come in, you can ask the family to come in. Because it's picking up the consciousness of everybody. And so some people set it up, run the test, and they leave the room. And that's also wrong, because you need that three-way loop. Exactly. Mm-hmm. No. It's right. Yeah. So it's you and the client and the higher consciousness. It's very important. And quite often I see sometimes a person comes in, then 3 family members come in. Then you get a lot of mixed signals. Has any of you noticed that? Yeah. Penny? Mm-hmm. Mm-hmm. Yeah. I've given you more points like of mania, acupuncture points. These are all the points that I use, and piggyback remedies. The Regenoplex remedies are very good, and also the liquid light. The liquid light remedies have really, really good resonances. Schizophrenia. Here the Guna remedy, BDNF, it's brain drain, neurofactor, and serotonin. Now this is, it's called crown of thorns. It's actually used for people in absolute state of collapse or really, really nervous breakdown, where they have a condition when they really can't make that change or the turnover, like in a case of a cancer patient. They are stuck. You treat them physically with all the stuff you have, but that emotional turnover, you can't get them going. These points around the head, they're called the crown of thorns. We have used actually a mixture of 2% procaine and 1% caffeine. And we've injected it just below the skin at these points, and then one on the top. And that actually rewires the brains to help them make that consciousness shift. Because a lot of people are stuck. So instead of, it's not everybody, unless medical doctors and people who are licensed to do injections can do this. But, so what I've done is I have an ampule of this solution that I made up. I get it from, in Canada you can get it from York Downs Pharmacy. And I put the ampule on the test plate. I go to the automeridian screen, consciousness form, put those points in. Go to the psychological line, you type in the unconscious resistance to change. In here. And you treat them. And you put those points in here. And you may not get the actual physical substance into the brain, but you're getting the harmonic of it into those points. It's like when if you have something you want to treat them with, as Desi said, that what the device will do, it'll pick up the harmonic. It won't pick up the full trivector picture, like what's on the items on the matrix, but it'll pick up enough of the signal that it will transfer. Are you with me? Good.
Would it also help for someone who's stubborn, doesn't want to...
Yeah, it will. If a smack doesn't work. Pardon? The Narayani remedies? You could put, there's a whole, in the Narayani special remedies from 1 to 10, there's many spiritual remedies in there that you could use. And just see which one resonates and you can piggyback it. The one remedy that I've advised most people to use freely is the remedy called divine protection. It's Narayani special number 2. The matrix number is 7287. You can actually make that remedy up on your test plate. I make it up in a 30 ml alcohol, and I put 15 drops in a spray bottle of the water, and I regularly spray my clinic and my home. It's a fabulous remedy. It just cleans the energy and protects. So all of you, use it. It does work. 7287. It's called Divine Protection. Now, all roads lead to Rome. Violetta spoke about aesthetic. Here's a very effective method that I've used using the Guna remedies. Now, in the Guna remedies, there is Omeo Formula 1, Omeo Formula 2, Formula 3, Formula 4, Made, and collagen. On the matrix, I think I have it here for you. See, I've got you aesthetic acupuncture, because you're not actually doing acupuncture, but you're doing it through the SCIO. The first session, you can do these points and piggyback the Guna formulas. Second session, you can do that. Now, I've also done remedies showing nervous breakdown, urinary tract infection, degeneration and neoplasm with bladder cancer. The phrenic nerve is a point, large intestine 17. This point here. The phrenic nerve is one nerve that as we get older, the nerve tends to lose its conductivity. And in most cases of cancer degeneration, this nerve is weak. So if people have a lot of degeneration, just doing this point by itself, large intestine 17, it stimulates the phrenic nerve. I got this information from Tom Tam, who is a doctor who treats using cancer patients. And in the piggyback, you can also type in any other organo remedies that a client needs. But the phrenic nerve, if you Google, read up on phrenic nerve, because it's a very, very important nerve to treat cases of especially degeneration. And we have it, the beauty of the SCIO is we have everything in there. You want to do osteopathy, it's there. Acupuncture is there. Chiropractic work is there. If you want to do any osteopathic work, you can work on the spinal chart, on the dermatones. That's you're giving, before someone goes in for an osteopathic treatment, you treat the dermatones. And then when they go to the osteopath finds a lot of, the body is not as resistant. For working with the telomeres and a sample of aesthetic treatment. Any questions so far? Sometimes I find that it does take that many times. Yeah, so. Yeah, the reason I like to do that is I like to get the automeridian panel. I like to get, when you open up the auto-diagnosis and you get the repair all, and when it's balanced, then you're starting basically, you kind of tune the body and the meridians to be in a balanced field, like a playing level field. And then whatever you want to test, you can test here. Substance, vitamins, supplements. And then I see how many fuchsias, and for example, someone may say that, oh, this supplement is, they're taking it, they take a lot of it, and you test it on them, and what they're taking it for, they may be taking it for the liver, and the liver is showing green and yellow. That means maybe they've had too much of it, or they don't need it anymore. Now there's different areas in the screen where you can actually test, sorry. This one? Oh, when you type in anything here, when you type in something, then that test button opens. So, it's there it is. Yeah. So once you type and run a test, it'll go away. Until you type something else again, that button will come back. In the SCIO itself, there's different areas where you can actually test products. The first place is you can test it here. It says here, test item on test tray. There we go, there. Now, because we don't have the full screen resolution here, we may not be able to see it. Oh, there it is, item to be tested. So you can test the item on the test tray here, there. So we just put the water there. So it gives us a reaction here. This is a good one. It's giving me 0 allergic reaction, resonance high of 100, rectification of 108. The coherence is very slow. So to me, the water is testing resonates very well with me. This is actually my chart. So it's resonating very well with me. Being rectified, I really don't need it at the moment. It's quite confusing with these numbers when you want to try to establish, is it really a client is allergic to something. The method I use is, if I get a high allergic reaction, high resonance, and a very low rectification, that means they need it, but at the moment they have a high allergic reactions. It's not rectifying, so that means it's not good for them. If they get a good rectification value, resonance being high, and allergic could be high, but for the moment it's okay. I wouldn't have them take any more because the allergic is still showing high. Any questions? Yeah, actually, with the plastic, you do get some resonance coming through, but I've been using in my clinic stainless steel. Yeah, even with the supplements, if I can actually put the supplements on the stainless steel. Yeah, you break open the right, right. It's just conductivity. Actually, even what works even better is a copper tray. A little copper tray. It's much better conductivity. But then again, you see, then you're worrying whether it's picking up the copper itself. So stainless steel being an alloy and less, because even the plate of the SCIO is stainless steel. So I figured stainless steel will work as good. Now that's one area of testing your product. Then the other place is you test it on the automeridian screen. And then another place where you can also test is the homeopathic on this screen. That's another place where you could test it as well. You type in the substance there and test it. I find homeopathics, I test most of my homeopathics here, and I've also been successful in duplicating homeopathics from the matrix here as well. We've done tests where a doctor in Mexico, who is a medical doctor, who knew nothing about homeopathy. So I gave him a short lesson. He was working with the SCIO. And I gave him a short lesson on basis of homeopathic medicines. And I gave him my manual for all the Narayani formulas. And being a doctor, he kept proper data and records. So he made up the remedies using this method here, duplicating them on the test plate. And he used it with his patients, and he was getting phenomenal results. What I have found, however, that the remedies prepared on the test plate last about 28 days, 28 to a month. And I type in the remedy there, and you type a potency there, and you first of all see the reaction of the remedy. And if I get a good, close to 100, then I know that potency is good. Then I duplicate. And I found you have to duplicate 3 times. But after you get the remedy off the plate, you have to succuss it on your hand. And they have found that succussing the remedy this way increases the intensity of the remedy, but if succussing it this way, it's only 50%. Yeah, this way. That's why they took it on yeah. And they found how they discovered that in the early days when they had the remedies in the kit, and they went on the horse and buggy, and they were going over cobblestones. So the remedies were being charged all the time. So the longer the distance they went, the remedies were stronger. Any questions? Oh, that's the feedback homeopathic. Also, if anybody wants to add anything, please feel free. Because, we're all sharing, we're all helping each other.
I find your test plate, you have the patching really different. I like it the way it was.
Before, oh yeah, because the EDUCTOR has an independent test plate. Yeah, but the test plate of the EDUCTOR is very effective. It's much, but except it's one extra thing to carry. Right.
One question regarding the process of the first menu on the left in this panel, and the other process is well described. And then at the end, we don't know what is the answer or what is the product. I don't know if you have followed this process. Have you done this?
Yes.
You know, I believe that there is a mistake at the end. We don't know what is the product that we need to give to the client. Anyway, I might just maybe talk to you in private about this because
Or you mean you don't know what product to type in there?
no, I mean at the end, all the process, as I said, the
Yeah, it's there. It's there.
I knew it was there, but anyway, I don't know how to interpret the answer. But maybe, as I said, I will maybe discuss with you in private, because it does not work. And the other day with the dizzy, he could not make it. So anyway.
Are you talking about this screen here?
Yeah, that was it. And then if you follow, you go to the second step and then the third step, and then it say, well, give the product to the client, and you say, well, which one, Anyway, as I said, maybe this is not a question to ask.
No, it's fine. No, there's no silly questions. Don't worry.
But you go, just follow the step of all this process, go back to the menu, take the step number 2, and then step number 3, and then, everybody will be able to maybe.
Are you talking about this particular screen here?
Yeah, but I am sorry because I don't have. You go on the first menu and you click the second step, because all the steps are there.
No, I think you may have to show it to me what you're trying to explain.
But as I said, I will have a look at that, maybe in private with you. But this is wonderful. This has been a process that has been well explained or described, so that we can do the homeopathy very easily. But somewhere there is some problem.
Another thing that I always like experimenting with different things on.
Anyway, it's mainly because I am not a homeopath. Desiree has done, all this process very nicely for us. Maybe for you, you are a homeopath. You don't need this process.
Well, later on you show me what you explain, and then I'll see if I can help you. Definitely. Now, I've also had a case where a client was taking morphine because they had cancer, and the morphine was giving them very severe side effects. So what I did is I put the morphine on the test plate, and see, it's not in here. Where it is, I think because of the screen resolution, it's missing out the end there. It says take energy from tray. So I took the morphine I put the actual morphine substance in here, and the SCIO will pull the energetic signal, the harmonic signal of the morphine, and then I duplicated the remedy. Then I go activate. Once it'll tell you actually energy loaded. Now I can't seem to get to the button. If I can, I'd love to show it to you. Okay, here it is. I can show it to you. Yeah, there we go. There we go. See that one says take energy from tray? So when you click that, it actually is loading the pattern of, it loaded the pattern of the morphine that the client was taking. So it says loaded. Then I double click on that to get rid of that. Then I say activate tray output, and I take the morphine away. And then I typed in, because you want basically the lowest potency of that same substance. So I did it in actually a 0.1x, and I duplicated the remedy in some drops, and the drops were 30% alcohol and 70% distilled water, and I did it 3 times. And then I told the client to take what we prepared on the test plate. They had 60% relief of pain, but they had to take more doses to get the relief of pain that the actual morphine ad was giving them, with no side effects. You got that?
So, like, morphine was twice a day, the drops might be 4
5, 6, he was taking 7 times a day. And it worked well. Now at least you know you're not getting a chemical in the body. But it picked up the harmonic of the morphine, and they were getting it as a homeopathic. Yes, with dopamine, yes. Yes, absolutely. Serotonin, dopamine, you can do the same thing. Because they are using synthetic dopa. Yeah. Anybody wants to add something? Please. Yes, you can. Absolutely. Then, if dopamine is on the matrix, you can type the matrix number here. Yeah, or you type in it the way it's written in the matrix. Easiest I find is put the matrix number. You can make a combination here of matrix numbers, but double space between the matrix numbers if you're making 3 or 4 together.
How do you decide the potency?
The potency, I'll show you. Okay, we'll just type in here, say, arnica, right? Arnica, and I type in a potency, say, 30x or 30C, and then you test. So we got a 40% resonance here. So maybe I'll change it to, say, 30x and see what happens. Still not good, so maybe we'll go higher. No? 6x. Still. So this is fairly good. So then that's how you can establish a potency. Low potencies are used in chronic cases. In acute cases, you use high potency starting at 200x. Then you can go to 1m, 10m, or 50m. In the matrix, Narayani balancing remedies are all 50m. And we found that 50m remedies can be repeated with no problem. I didn't find it very accurate. I tried many times using it and I just got frustrated. It didn't. Yeah. For those who want to use it, it's there to use. I tried using it, but somehow another homeopath myself, we were playing with it and we just didn't find the accuracy wasn't that good. She's talking about where you click on the list of remedy and then where you choose the potency. So you can actually type the remedy here. And you want to check potency here. No log, please repeat. So that's the problem with that screen we've been having. The other way you can do, if you want to test this one here, if you go to show by value, if you double click on this, the remedy goes into the panel there. And then we can check for potency there. See, that keeps giving this message, so I just got frustrated with it. Any more questions?
The meridian panel, when do you recommend to use
Quadrant? If a client has got specifically one area of the body that's really very problematic, then you can use a quadrant therapy there. Yeah. And then also on the, coming back to the automeridian screen, shit. No, I'm sorry. What I was thinking of was this screen here, the time therapies, where you can actually help with restoring some organ function. And when you click on this one, for example, if you want to work on their lungs, and you click on this one, it'll give you a time that this will take 24 minutes. Do you wish to continue? I generally say no and try it again. It'll give you another time. And you click again, 12 minutes. So I'm trying to bargain with the computer. So I got 8 minutes. Okay, we got 8 minutes. We can give them a treatment of 8 minutes. So this is great if you are doing, there's stem cell stimulation. If a person has a degenerative organ like a kidney, you go to the stem cell stimulation, go to the matrix, work on everything to do with lungs, go on the automeridian, work on the lungs, then come to the time therapy and you treat the lungs or the kidneys and you treat it. When you're done, you go back to the stem cell treatment and do stem cell balance. Good? Any more questions? Now another thing, all of you work on your computers. I showed this in Oradia. All of you work on your computers all with your clients, and they found that gallbladder 21 point, which is here, you're constantly all day working like this. These meridian points get blocked and the energy is blocked to the chest, and in case of women, they end up with lumps in the breast. So there is a yoga exercise which I'm going to show you. It's very simple. I'm going to make you do it right now. I'll use the mic to tell you what I'm going to do. You breathe in through the nose, and then you're going to breathe out through the nose. And in the process, I'll leave the mic down. Yeah, like you can do it 4 times, 5 times.